Welcome to the Nurse Practitioner Client Admission and Discharge from Hospital Settings Practice Guideline Education module. This module is based on our Practice Support Guideline located on our website. In this module, we will cover the role of the Nova Scotia College of Nursing, the legislative authority for nurse practitioners to admit and discharge clients to and from hospital settings, nurse practitioners' professional accountability related to the professional scope, individual scope, and scope of employment, elements that nurse practitioners need to consider related to admission, discharge, and liability protection, and wrap up with some key points. The mandate of the Nova Scotia College of Nursing is to serve and protect the public interest, preserve the integrity of the nursing profession, and to maintain public confidence in the ability of the nursing profession to regulate itself. We achieve our mandate through promoting good practice, preventing poor practice, and intervening when practice is unacceptable. There are approximately 16,000 nurses registered with the college that provide nursing services to Nova Scotians. This includes licensed practical nurses, registered nurses, and nurse practitioners. Of the 16,000 nurses, approximately 300 are nurse practitioners. The Standards, Guidance, and Customer Experience Practice Consultants guide nursing practice by providing regulatory guidance to registrants and a variety of stakeholders. We do this by the development of various tools that are available on our website. These include practice guidelines, Q&As, toolkits, and online modules. We provide practice consultations in a variety of ways. These include phone, email, or on-site. We also provide education on topics such as leadership, collaboration, scope of practice, or specific to the needs of the consultation. These education sessions are provided through invitation from employers or nurses. The college does not create best practice guidelines on specific nursing interventions. Employers may reach out to us to provide feedback from a regulatory perspective on a specific policy, but we do not create organizational policy. All of our practice consultations are confidential. We do not breach confidentiality. In situations where client safety is at stake, we have the accountability to report. There may also be situations when we may need to collaborate with others on the team prior to providing you with a response. In those situations, we ask your permission, and the information we discuss as a team is confidential. In addition, we do not resolve employment disputes. We will now address the legislation that provides the authority for NPs to admit and discharge clients to and from hospitals. The Nursing Act is the foundation upon which entry-level competencies and standards of practice are developed. The legislative scope of practice for NPs is outlined in Section 174 of the Nursing Act. Admitting to and discharging clients from hospitals is within the professional scope of practice of NPs. However, previous provisions in the Hospitals Act prohibited NPs from admitting clients to hospitals. The Hospitals Act provides the authority for a variety of practitioners to admit and discharge clients from hospitals. This includes settings defined as a hospital in the Act. In 2015, amendments to the Hospitals Act authorized NPs to discharge clients from hospitals. On April 22, 2022, additional amendments authorized NPs to admit clients to hospital. It is important to recognize that these amendments are enabling rather than mandatory, meaning that on an individual basis, health authorities, hospitals will have to work through these new provisions for their organizations to implement these changes. NPs are authorized to admit clients to long-term care under the Homes for Special Care Act. More information can be found in our Nurse Practitioner Practice Guideline available on our website. NP practice is defined based on the following elements: professional scope, individual scope, and scope of employment. In the next few slides, we will describe the elements and discuss the NP's specific accountabilities related to them. The professional scope of practice represents the broadest category and is informed by the Nursing Act, the NP Standards of Practice, entry-level competencies for nurse practitioners in Canada, and other related provincial and federal legislation. Admitting clients to and discharging clients from hospitals is within the professional scope of practice of the NP. The changes to the Hospitals Act authorizing NPs to admit clients to hospitals enables further optimization of the professional scope of practice for NPs in Nova Scotia. NPs are accountable to provide safe, competent, compassionate, and ethical care within their professional scope of practice. The individual scope of practice is the range or extent of practice within a nurse's professional scope. The individual scope of practice represents an NP's practice based on their entry to practice education, practice experience, practice context, and any beyond entry-level competencies acquired through additional education over the course of a career. The individual scope of practice for a recently graduated NP would be very different from an NP in practice for 5, 10, or 15 years. And similarly, the individual scope of practice of an NP in one practice setting may be very different for an NP transitioning to another completely different practice setting. NPs are accountable to provide safe, competent, compassionate, and ethical care within their educational preparation and individual competence. NPs must work with their employer to attain the necessary education and competencies to safely admit or discharge clients from hospital. NPs are required to collaborate, consult, and refer clients to the most appropriate healthcare professional when the client's needs are beyond their competence, individual, and/or professional scope of practice. The scope of employment is defined by the employer through the job description, policies, guidelines, and context-specific education. The scope of employment has a significant impact on the NP's individual scope of practice. As mentioned, admitting to and discharging clients from hospitals is within the professional scope of practice of an NP. Additionally, an NP may possess the competencies to admit and discharge clients. However, if the employer does not provide the authority for the NP to admit and/or discharge, admitting and/or discharging a client would not be within the employment scope of the NP. NPs are accountable to practice in accordance with employer-specific policies, processes, practices, and/or guidelines related to the client admission and discharge process. This includes, but is not limited to, the authority to admit or discharge in a specific facility, the determination of the most responsible provider, transfer of clients from one unit to another or one facility to another, inpatient and post-discharge care needs and resources for clients without a primary healthcare provider. NPs are expected to demonstrate leadership in the development of policies to optimize their individual scope of practice within their employment setting. NPs are accountable to practice in accordance with their standards of practice, code of ethics, and employer policies to ensure they are providing safe, competent, compassionate, and ethical nursing services at all times. Additionally, they must obtain and possess the necessary knowledge, skill, and judgment to competently admit and discharge clients from hospitals. As NPs prepare to engage in the practice of client admission and discharge from hospitals, there are a few components that NPs need to consider. It's important to highlight that these are not an exhaustive list. With respect to the admission process, some components to consider are: the client's diagnosis indicates in-hospital care is appropriate. The client is informed about the diagnosis, treatment plan, and the need for hospital admission. The client is the individual and may also include the substitute decision maker for the individual where the context requires. Consult and collaborate with the interdisciplinary team or another provider as needed. Collaborate with other care facilities to obtain information on the client's health as needed. Follow employer policies, processes, and guidelines related to client admission and care. With respect to the discharge process, some components to consider are: the client's assessment supports discharge from hospital. Post-discharge care can be managed in a setting outside of the hospital. A discharge plan is in place and includes consideration of the need for supports, services, equipment, or personnel, referral to other care facilities or agencies, follow-up care needs post-discharge, the education and information needs of the client, family, or other caregivers. With respect to liability protection, all NPs licensed with NSCN have professional liability protection from the Canadian Nurses Protective Society, or CNPS. CNPS is aware of this change in legislation and scope of NPs here in Nova Scotia. For questions regarding your liability coverage related to your responsibilities for client admission and discharge, please contact CNPS. In summary, NPs have the authority to admit and discharge clients to hospitals under the Hospitals Act. NP's ability to both admit and discharge clients will improve access to health services for Nova Scotians. NPs must attain the necessary competencies related to hospital admission and discharge and work within employer policies and processes. NPs with questions related to liability coverage regarding responsibilities for hospital admission and discharge should contact CNPS. Thank you for participating in this education module. The Nurse Practitioner Client Admission and Discharge from Hospital Settings Practice Guideline can be found on our website. We encourage you to reach out to the practice team should you have any questions.